Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. A quick note whether I'm audible and visible. Hmm. Yes. So, yes, Shubhratri and welcome everyone. I hope all of you are doing well. So, here we are in this session of anti cancer drugs because today, in the timetable that we are following on the Telegram group as well, we have pharmacology going on. We are towards the end of pharmacology. So, that's why I thought of let's simplify this topic of anti cancer drugs, focusing on the most important points and more so telling you the tricks and the mnemonics to remember the important points in anti cancer drugs. I hope I'm able to see the live chat. Just give me a minute. Okay. So let's start with that. And before that, because before I forget, let me tell you about today is the last day basically where you get 6 months subscription, 25% off. So now with the 25% off, you get the 6 month subscription at around 14.3K. You need to use the code. You have the code Dr. Nikita. And we are starting with the ACE next batch on 21st of June, right? Apart from that, we also have now the NEET PG Vitals, which are available. Vitals are the studio recorded classes, right? So the structured, organized videos for all the subjects are available. Plus, tomorrow morning at 11 a.m., 11 to 1:30. So basically, we have 100 questions ka test, and the top 3 learners will get free mentorship session from the top faculty. So we have the test tomorrow at 11 a.m. So if you want to assess yourself and practice some MCQs, you can appear for this test as well. Okay. So having said that, let's start with the first one: the classification of the anti-cancer drugs. Now, this is the first point where the question is asked. And here, the most important question which is asked is which of these is not an alkylating agent? So basically, you need to find out that which of these is anti-metabolite. Okay, which of these is anti-metabolite? So anti-metabolites are identified by, first let me tell you the trick for what are anti-metabolites and how do you identify them. See, when I say it is anti-metabolites, basically they are interfering somewhere with DNA synthesis, and whatever is required for DNA synthesis, that is purines, pyrimidines, the ribonucleotides, which then form the deoxyribonucleotides. So that is affected. Which are the purines? Remember puree. What puree we are eating? Egg puree. So A and G are purines. Pyrimidines basically is pyrimidines is cut. Okay, that is CUT. That is cut. And what else? What vitamins are required for DNA synthesis? Folic acid is important. So the drugs inhibiting folic acid also, like which is the drug which inhibits dihydrofolate reductase? So it is methotrexate, right? So even methotrexate is an anti-metabolite, very, very important and a frequently asked question. So remember that methotrexate is an anti-metabolite. Okay, methotrexate is an anti-metabolite. So which are the anti-metabolites? Purines, the A and the G. Pyrimidines, the CUT. So you have C wala drug, which is cytarabine, is an anti-metabolite. B wala drug 6-thioguanine is purine. Purine जिसके नाम में आता है 6-mercaptopurine, it's an anti-metabolite, right? Then you have U wala 5-fluorouracil, it's an anti-metabolite. So all of these drugs are anti-metabolites drugs, right? So to name the few: methotrexate, 5-fluorouracil, cytarabine, 6-mercaptopurine, 6-thioguanine, all of these are anti-metabolites. Okay. Then you have the drugs. Next important question is which are the drugs acting on the microtubules? Okay, which drugs act on microtubules? So for that you can remember microtubules, microtubules is MTV. Okay, remember it is the MTV. I hope I am visible as well. Okay. So what are the microtubules acting drugs? It is MTV, that is taxanes and vinca alkaloids. Okay, taxanes and vinca alkaloids act on microtubules. So vinca alkaloids, it includes vincristine and vinblastine. You have paclitaxel, docetaxel, that is taxanes. Now, so that is, remember, it is MTV. Okay, it is MTV. Now, what is the difference in between the two? Okay, what's the difference in between taxanes and vinca alkaloids? So remember that, just give me a minute. Let me add some slides so that I can write on that. Otherwise, it will get all hotspot. 8 minutes. Yes. So we were talking about the microtubules acting drugs. We have vinca alkaloids and we have taxanes, which includes the paclitaxel. Okay, which includes the paclitaxel. Absolutely. Remember that vinca is IN. IN matlab it inhibits the polymerization. Okay, it inhibits the polymerization. Paclitaxel P for P, that means it promotes the polymerization. Right, so remember paclitaxel PPP, it promotes the polymerization. Then it is basically inhibiting the disassembly. Vinca, by inhibiting the polymerization, it is inhibiting the formation itself. Okay, that is the difference in between the two. Now the next that you have topoisomerase inhibitors, topoisomerase 1, topoisomerase 2. So remember when I say 1, remember 1 ON is AN. So the TICANs are basically topoisomerase 1 inhibitors. So T for T topoisomerase, AN tells you that it is 1 inhibitor. So topotecan, irinotecan. The next that you have is topoisomerase 2 inhibitors. 2 is TO. So remember, etoposide is topoisomerase 2 inhibitor. So what did we learn next is the topoisomerase inhibitors, topoisomerase 1 and 2. TCANs. Okay, TCANs and you have etoposide. Okay, TCANs and etoposide. This is 1 and it is 2. Can someone tell me with irinotecan? Where is it used? What is its side effect? And where it should not be given? What is the use of, where is irinotecan used? What is the side effect? And where it is contraindicated? Tell me all of these. Where is irinotecan used? Yes. Irinotecan is used in colorectal cancer. Okay, it is used in colorectal cancer. Very good, Samriddhi. It is contraindicated in Crigler-Najjar syndrome. That's a previously asked question. Absolutely right. It is used in colorectal cancer. What regimen do you have colorectal cancer where irinotecan is there? It is FOLFIRI regimen, right? The FIRI mein, the IRI tells you that it is irinotecan. What is the side effect? It is used in colorectal cancer and it is doing the side effect there only. Okay? So basically the side effect is, the dose limiting side effect is diarrhea. And where is it contraindicated? It is contraindicated in Crigler-Najjar type 1, where we have completely absent UGT1A. The conjugation wala enzyme is absent because this UGT1A1 absent hoga to irinotecan ka toxicity बढ़ जाएगा. So very very important question. Remember that it is contraindicated in Crigler-Najjar syndrome. Okay. Now next one is antibiotics. That includes your doxorubicin, daunorubicin, actinomycin, right? Even bleomycin, all the mycins here. Mitomycin, bleomycin, actinomycin, and you have the rubicins. Mitomycin C ka important one that has been asked in the recent NEET PG also. It is used in the laryngotracheal stenosis. To prevent that, we use this mitomycin C. Okay, it is also used topically in superficial bladder cancer. In superficial bladder cancer, also we use this. Okay. Next one, hydroxyurea. Can someone tell me the mechanism of action of hydroxyurea? What is the mechanism of action of hydroxyurea? Yes, yeah, I'll come to the side effects one by one as well. Hydroxyurea ka mechanism of action. Let me see who gets this right. Very good, Samriddhi, right? You seem to have read this topic very well. What is the side effect of the mechanism of action of hydroxy? Hydroxy, matlab, remember hydrogen wala, matlab reduction wala. It is reductase enzyme that it inhibits. Which reductase enzyme? It inhibits ribonucleotide reductase. Okay, it inhibits ribonucleotide reductase. Absolutely right, Campylobacter. I don't know your real name. It is used in sickle cell anemia as well. Okay, so that is the mechanism of action. Hydroxy is reductase. L-asparginase. L-asparginase used in ALL as well. What are the side effects that you see with L-asparginase? Remember asparginase, as the term says, aspargin ko break down karne wala. Now aspartate, aspargin, this is amino acid which is required for, amino acid is required for protein synthesis. So basically it is acting by inhibiting protein synthesis, not the DNA synthesis. And example of protein, remember anticoagulants. So if these amino acids are not there, anticoagulants will be affected. So what do we have here is hypercoagulable state is what you will have here. Hypercoagulable state is a side effect. It affects the pancreas, right? जहाँ पे बहुत सारे proteins वाले बन रहे enzymes. It causes pancreatitis. When the pancreas is affected, insulin affected. So remember, it can cause hyperglycemia as well. Okay, it can cause hyperglycemia also. So hypercoagulable state, pancreatitis, and hyperglycemia. So suppose if they give you a clinical scenario, see all these flashcards, one-liners are important because they can be converted into clinical scenarios like a patient of ALL on treatment was on a drug, and now you see that there are increased serum amylase levels. So what drug was the patient on? The patient was basically on L-asparginase because increased serum amylase tells you that it is pancreatitis. Okay. Next one that we have tretinoin arsenic trioxide. Where is arsenic trioxide used? AML subtype. Remember tri for 3. It is used in AML subtype M3. Okay, it is used in AML subtype M3. That is ETRA. Okay, arsenic trioxide wala. It is used in arsenic trioxide and tretinoin. That is all trans-retinoic acid. So both of them are used in tra and tri are used in AML M3. Okay, they are used in AML M3. Right? Now coming to the next one, that is the most important side effects that we will discuss first. Yes, like someone was mentioning, what is the side effect that you see with doxorubicin, donorubicin? Remember the D, and the D. The side effect that you see with doxorubicin, donorubicin is dil wala side effect. That means it is cardiotoxic. The drug which is used to decrease the toxicity is again with D. That is dexrazoxane. Okay, that is dexrazoxane. Next one for methotrexate. What are the side effects that we have with methotrexate? Most common is stomatitis, a lot of ulcers that the patient gets. It can cause pulmonary fibrosis also. It can affect the liver also, right? And what drug do we use to decrease the toxicity? We use folinic acid. Okay, we use folinic acid. Okay. Yes, it can cause megaloblastic anemia because by inhibiting the folic acid. Okay, by inhibiting the folinic acid. Next that we have is cyclophosphamide. Cyclophosphamide causes what side effect? Cyclo affects the circular organ in the body. That is the, remember like cyclo is circular cystitis, CY. This is the drug which can cause hemorrhagic cystitis, and you can prevent this with by giving mesna. Okay, we can give mesna. Hemorrhagic cystitis. Cystitis is cyclophosphamide. Okay, cyclophosphamide. Very, very important. Next one, cisplatin. What are the important points for cisplatin? Cisplatin, remember, is the most emetogenic drug acting on the CTZ, the chemo trigger zone, and it is the most emetogenic. It can cause almost everything: ototoxicity, nephrotoxicity, right? And to decrease the nephrotoxicity of cisplatin, what drug do we use? We use emifostin. Okay, we use emifostin to decrease the nephrotoxicity of cisplatin. Yes, it can cause peripheral neuropathy also. Coming to vinca alkaloids. In vinca alkaloids, you have vinblastin and you have vincrustin. Vincristine and vinblastin. What side effects do you see with vinblastin and vincristine? So remember, vinblastin, B for B, it blasts the bone marrow. So it causes bone marrow suppression. Vincristine does not cause bone marrow suppression. So remember, vincristine is bone marrow sparing drug because it is not causing bone marrow suppression. With vincristine, peripheral neuropathy is what is the side effect that you see with vincristine. The glove and stocking type of neuropathy is what you see with vincristine. So remember, this is bone marrow sparing. That's an important question. So out of vincristine, vinblastin, it is vincristine which is bone marrow sparing. Which is that anti-cancer drug which can cause flagellate dermatitis? A previously asked question where they give you the image and you have this flagellate dermatitis. What drug causes flagellate dermatitis? So remember, these are like the blue marks on the skin. Very good. So remember, flagellate dermatitis is blue, that is bleomycin. Bleomycin causes this flagellate dermatitis. Bleomycin also causes another side effect, that is, remember, B for B, affecting both the lungs. So you have bleomycin and you have busulfan, which affects both the lungs. Bleomycin and busulfan, they cause pulmonary fibrosis. So you should do PFT with these drugs. Okay, PFT should be done with these drugs, right? Clear with everyone? Now let us have a look at some of the important other things also. This is a bit unclear slide, but I'll read it out for you. So this is the sequence basically that you have purines, pyrimidines, they form ribonucleotides, then you have deoxyribonucleotide, then the DNA is formed, RNA is formed, and proteins are formed. If I ask you which drug is inhibiting the protein synthesis, L-asparginase, right? Because amino acid wala hai. Microtubule MTV, it is a vinca and the paclitaxel, and remember colchicine. Which gout drug acts on microtubules? It is colchicine. Inhibiting ribonucleotide reductase is hydroxyurea. Inhibiting DTMP synthesis, remember 5-fluorouracil. Very important, 5-fluorouracil inhibits DTMP synthesis, and that is why it is said to cause thymidine-less death of the cells. Mercaptopurine, thioguanine, these are acting on purines. Okay, these are acting on purines. Next one, now coming to the cell cycle phases where these anti-cancer drugs are acting. Which cell cycle phase, which anti-cancer drug is acting? Very important. Now, when I said that microtubules pe act karne wala is MTV, remember these microtubules are playing the role in mitosis. So here you have the M phase is basically mitosis wala is your MTV, the microtubules wala. Okay. The next that you have anti-metabolites. We said that it inhibits the DNA synthesis. So it is the S phase. So remember, anti-metabolites like methotrexate, 5-fluorouracil, they are basically acting on the S phase. Another important question, which anti-cancer drug acts on G2? G2 is bivala, bleomycin, that is like bi. So G2, it is acting on the G2 phase. Okay, it is acting on the G2 phase. Another important question. So M is the microtubules MTV, S is the anti-metabolites, and G2 is bi, that is bleomycin. Okay, remember it is bleomycin. Next one, now coming to some important side effects. Some rapid fire sort of thing here. So tell me, which anti-cancer drug can cause adrenal insufficiency? Which anti-cancer drug can cause adrenal insufficiency? Very good, Samriddhi. You remember all the mnemonics? So this anti-cancer drug tells to the adrenal, bus karo. No more adrenal hormones. Now I will suppress you. Bus karo. So bus karo is busulfan. Busulfan, that is busulfan, is adrenal insufficiency. Very good. Disulfiram reaction and MAO inhibitor. Remember, there is one, if like, summer season. So I remember this, you get a lot of crush and sharbat basically from the brand, which is MapPro. So MapPro wala is MAO inhibitor is procarbazine. Okay, procarbazine. MapPro is procarbazine. And disulfiram, when you read ulta, that is also MA. Okay, that is also MA. So remember, it is MA MapPro. MA या ऐसा MA. ठीक है? Even most leukemogenic is also procarbazine. Pancreatitis is L-asparginase, hypercoagulability, hyperglycemia. We have seen this. Prolonged neutropenia. That means drug का effect गया लेकिन neutropenia बहुत ज़्यादा है. So when you see a mast wali car, that is car mastin, it gives you a long after effect. काश मेरे पास भी ऐसी car हो. For a long time we keep thinking about that. Remember, must car dekh ke we have a long side effect of that, prolonged side effect. So car masti. Hand, foot. Okay, so hand, foot. When I say foot, so remember FU, that is 5-fluorouracil. So we have hand, foot, and the cap. What is the precursor, the prodrug for 5-fluorouracil? It is cap wala drug, that is capecitabine. Remember, capecitabine, 5-fluorouracil is hand, foot. And also remember that this 5-fluorouracil, foo karke, it goes out from the lungs. So basically it has lung excretion. Okay, it has lung excretion, right? Next one that we have, flagellate dermatitis, हमने already देखा. Bleomycin, most emetogenic CTZ वाला act करने वाला is cisplatin. Okay, that is cisplatin. So this is the table that is already filled in here. So now going to next one. This I already mentioned that UGT 1A1 का टेस्ट कौन सा ड्रग देने के पहले करना पड़ता है? It is irinotecan. Thank you, Bulhandor, for those kind words. Thank you so much. So irinotecan, basically that is why it is contraindicated in Crigler-Najjar syndrome. DPYD gene का टेस्टिंग करना पड़ता है for 5-fluorouracil. You can remember this PYD is like PY is pyrimidine wala. Which are the pyrimidines cut? So U wala drug, that is 5-fluorouracil. For that we need to test this DPYG gene. Okay, very, very important again. Which anti-cancer drug causes thymidine-less death? We said it is 5-fluorouracil. Okay, it is 5-fluorouracil which causes thymidine-less death. Folfiri regimen. We already said that used for colorectal cancer. Okay. It is colorectal cancer. Thank you so much, MD, again for those kind words. Colorectal cancer, because being there, done that, I know that remembering all the 19 subjects is difficult, right? There is no dearth of content, I believe, in this digital world. What is more important now is how to remember whatever you are studying. That is the most important, because that effectively decreases the number of revisions, right? So colorectal cancer, folfiri, folinic acid, 5-fluorouracil, and irinotecan. So in folfiri, the fol stands for folinic acid. So why are you using folinic acid here? Why are we using folinic acid here? Remember, folinic acid, if the question is, it is used to decrease the toxicity of which drug? It is methotrexate. If the question is, it is required for the action of which drug? Folinic acid is required for the action of which drug? It is 5-fluorouracil. Okay. So that is why you have here folinic acid along with 5-fluorouracil. So like folfiri, you have the FOLFOX regimen also. So again, you have folinic acid with 5-fluorouracil and oxaliplatin. Okay. Next one, what are the uses of these some rare anti-cancer drugs? Exabepilone. Remember exabepilone, BEBE. It is used in breast cancer. Okay, so important question. Where is hexabipolin used? It is used in breast cancer. Can you also tell me the monoclonal antibody used for breast cancer? The HER2 wala, it is trastuzumab. Tras2 is acting on HER2. Trastuzumab is a monoclonal antibody used in breast cancer. So can you tell me what is the side effect that we have with trastuzumab? What side effect do we have with trastuzumab? Is it nephrotoxic, hepatotoxic, cardiotoxic, or pulmonary toxicity? Very good, Campylobacter, absolutely right. It can cause cardiomyopathy, cardiotoxic drug. Okay, it is cardiotoxic. Where do we use meclorethamine? So remember, meclorethamine, M and C, it is mycosis, the cutaneous one, that is mycosis fungoides. Okay, it is used in mycosis fungoides. Pemetrexate, where do you use pemetrexate? So remember, ME for ME, it is used in mesothelioma. Pemetrexate is used in mesothelioma. Pralatrexate, the T, remember T for T, it is used in T cell leukemia lymphoma, not the B cell. Okay, remember it is used in T cell, not the B cell. Okay, so these are the uses that are highlighted here. Hexabipolin, breast cancer; meclorethamine, mycosis fungoides; pemetrexate, mesothelioma; pralatrexate, peripheral T-cell lymphoma. Okay, pralatrexate is peripheral T-cell lymphoma. Yes, MD, I'll share the PDF on the Telegram group after the session is over. Okay, so on the Telegram group, I'll share that. Right. So now coming to the last part here, okay, of, previously this question has been asked. So if at all this repeats, we should know this. So let's say that this image is given and you are asked कि इसमें से कौन सा anti-cancer drug बनता है? Right, so suppose this wala image, the second image is what is given, this purple color wala flowers. So what anti-cancer drug is derived from this? Yes, what anti-cancer drug? Anybody? Is it irinotecan? Is it paclitaxel? Is it vincristine? Is it etoposide? Very good, surgeon on board. It is vinca alkaloids. Okay, so you can remember this as vinca alkaloids. Okay, yeah, absolutely. So vinca alkaloids, VI and CA. So vinca comes from violet colored flowers. What is the name of the plant? The CA, that is Catharanthus. Okay, that is Catharanthus roseus, and it is violet color is vinca alkaloids. Okay, violet color is vinca alkaloids. Next one, if this plant is given, where you see this bunch of the prominent ऐसे appearance, thorn जैसा appearance, which looks like the warts. Okay, condyloma acuminata. So basically this one is Camptotheca acuminata. कॉन्डाइलोमा अक्यूमिनेटा के जैसे वॉटी अपीयरेंस, और इसमें से क्या था, ये कैम्टो है तो कैम्टोथिकैंस आते हैं, कैम्टोथीका, थिकैंस, दैट इज टोपोटिकैन, आइरिनोटिकैन. राइट. Next what we have is taxus. The taxanes come from U. So alphabetically remember, T के बाद आता है Y. So it comes from the bark of the yew tree. Okay, it is the bark of the yew tree, taxus. The common name is yew. And then you have this podophyllum, which has phylum, ये leaf वाले multiple ऐसे leaves. Podophyllum is etoposite. P-O-P-O, it is podophyllum is etoposite. Okay, it is podophyllum is etoposite. Okay, yes, absolutely, Campylobacter, that's the mnemonic there. P is for M and M is for P. In psoriasis, you have Munro's microabscess. In mycosis fungoides, you have Pottrier's microabscess. Right, so correlating with dermat, remember P is for M and M is for P. So that is what you have: psoriasis, Munro's, and mycosis is Pottrier's. Okay, mycosis is Pottrier's. Right. So yes, that completes the quick review of the anti-cancer drugs. I've tried to include all the important points that are asked very, very frequently in the exam. Your homework is to revise this, make one-page notes out of the session that we have discussed today, And yes, you can share on the social media as well. And please do solve the MCQs also, right? Your anti-cancer drugs basically should come in one page, whatever are the important points. And whenever you come across new information for a particular topic, keep adding on to that topic so that it's not scattered, everything is at one place. Okay. Yes, Milan, we'll be having the KBMD sessions also too. And tomorrow 6 p.m. also we have the YouTube live session for radiology, the PYQs in radiology. Okay. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, and keep winning. And I'll see you again tomorrow at 6 p.m. for the most important points and images in radiology. Okay. Thank you so much.